Fortunately, smallpox is a disease that no longer exists naturally within the environment. Um, so that's what I mean when I say that the disease has been eradicated. There hasn't been a case of smallpox since 1977. So it is impossible to get smallpox from a natural infection from exposure somewhere in the environment. They were able to effectively eradicate it in the 70s through the use of a vaccine. So essentially, at one point, the virus that causes smallpox had no host to infect, because if it tried to infect people that had already contracted smallpox, they were immune from previous exposure. If it tried to infect people who had gotten the vaccine, they were immune as well due to the effects of the vaccine. So essentially, the virus that causes smallpox had no host to infect, and then eventually was rendered inactive and now no longer exists in the natural environment. Eventually, we would like to get to the point where all infectious diseases are eradicated, and polio is kind of next on the list. It was easier with things like smallpox and potentially polio in the near future because those viruses don't mutate rapidly, so you could control them better with vaccines. Something like seasonal outbreaks of influenza and COVID, those ones are going to be more challenging to eradicate because they have high mutation rates. So they're constantly changing, which can affect the effectiveness of the vaccine. But luckily, smallpox is a disease that we, for the most part, don't have to worry about because it's been eradicated. Now, there are some concerns with its use as a biological weapon. The smallpox virus was used in the 1700s during the French Indian War, where smallpox blankets were sent to Native Americans. They were contaminated with the virus that causes smallpox. So when the Native Americans used the blankets, they became infected with smallpox, and it was used to wipe out an entire population. So because this virus still exists in certain labs, there is a potential risk of that, of it being used for biological attack. Like I said, it's not found naturally in the environment, but there are 2 lab facilities that do have strains of the virus that causes smallpox that they use for research. And those 2 labs are the CDC in Atlanta, Georgia, and then Russia also has a research laboratory that it uses for research on the variola virus, which is the virus that causes smallpox. So if it would ever come out and be used as a biological attack, it would be very likely that it would come from one of those 2 facilities. But it is no longer found naturally in the environment anymore. So what is smallpox? So smallpox is a viral infection caused by a virus known as the variola virus. So the variola virus is the virus that causes smallpox. It is highly contagious as it is spread through respiratory droplets. So someone that has smallpox will be shedding the virus in their mucus droplets, where they could easily infect someone else. This virus is also unique because it can survive on inanimate objects called fomites, things like clothing and bedding. It can survive on those objects for a long period of time, approximately 48 hours. A lot of viruses, if they're on a surface like that, will only survive for a couple hours. So 48 hours is a longer period of time for a virus to survive. And that's a concern as far as biological warfare. This virus could be easily sent on materials and then used to infect individuals with. So as far as transmission, respiratory, and then also indirect contact through inanimate objects or fomites. As far as signs and symptoms, the predominant sign that I want you to know is the pustular lesion. So someone that has smallpox are going to have pus-like lesions that pop up throughout their entire body. We see those in this image here. They're definitely more concentrated on the face and neck because of that respiratory transmission, but eventually it will progress throughout the rest of the body. And the interesting thing about these lesions is that the virus is targeting the deeper layers of the skin, the dermal layer, which does not regenerate itself. So even in individuals that survive smallpox, because it targets the deeper layers of the skin, it would cause permanent scarring that would last the remainder of someone's life. So survival usually was followed by pretty severe scarring. So the predominant sign that one would experience would be these pus-filled lesions that would pop up all over the entire body. And that was just kind of the first part of it. Some individuals were lucky and that's all they would experience, but a lot of individuals would experience some of the more dangerous signs and symptoms. So at that point, once the virus targets the skin, it continues to spread throughout the blood, throughout the rest of the body. One area that was hit particularly hard was the lungs. So typically the virus would induce or would cause inflammation in the lungs, which would ultimately cause fluid to build up and lead to pneumonia. Also, as the virus continues to spread throughout the blood to all the internal organs and tissues, it typically would lead to hemorrhaging, which would result in blood loss to those specific areas, which would ultimately lead to organ failure. So many individuals did die from the variola virus, typically about 10 to 16 days after the signs and symptoms began. As far as treatment, unfortunately, there was no treatment. So honestly, if you became infected, it was your main hope that your immune system was strong enough to overcome the impacts of the virus. That's all that could be done. Obviously, there was supportive care like monitoring signs and symptoms, watching the fever, maybe supplemental oxygen if needed. But really, it was just hoping the immune system would be able to overcome the impact of the virus. Since there was no treatment for the infection, vaccination was very important. So there was a vaccine that protected individuals from smallpox. They stopped vaccinating in the 70s because they were able to eradicate the disease. So if you were born after, I believe, 1972 or 73, you likely are not vaccinated for this because there was no need because the disease was eradicated. Really, the only individuals that still actively get vaccinated are those in the military because of the risk of bioterrorism. However, if there would be a biological attack and the variola virus would be released as a way of bioterrorism, they have stockpiled the vaccine that was used in the 70s, and it would likely still be effective because this virus does not mutate rapidly. So if we one day would have be under a biological attack, it would definitely be a vaccine that I would recommend getting because smallpox had a very high mortality rate. It was a very deadly infectious disease. Right. So now to kind of a definitely more milder infection. This disease is known as impetigo. And impetigo is a minor bacterial infection. So it typically is this disease is typically, it typically causes these crust-like lesions to form predominantly around the mouth or on extremities like the back of the hands. So because this is a bacterial infection, the causative agents are a little different. Most of the things that we've talked about prior were all viral diseases, but this is one of the first bacterial skin infections that we'll talk about. And it's caused by two different types of bacteria. These bacteria can cause the infection independently, or they can work together to cause the infection. But the two causative agents are bacteria known as Staphylococcus aureus and Streptococcus pyogenes. Both of these bacteria can cause other infectious diseases. For example, Streptococcus pyogenes can cause strep throat, but if they get into a pre-existing skin wound, they can easily cause a case of impetigo. Impetigo is definitely more common in men and children, and the reason for that is because these bacteria are commonly found in the nasopharynx, which is the nose and throat. Most of us just naturally have these bacteria in that region of our body. So if we kind of think about children, when children have a cold and their nose starts to run, that fluid that's coming from their nose will likely pull some of those bacteria out of their nose, the staph and the strep. And if they have any small cuts around their face, it'd be very easy for the bacteria from the nose to get into those small cuts and then cause an impetigo outbreak, typically around the mouth. The reason why we also see impetigo a lot on the back of the hands is because we think about children and even some adults. Nose runs, you don't grab a Kleenex, you just back of the hand right under the nose. If you have any type of small cut on the hand and some of the bacteria from the nose get into that skin wound, you could potentially get an impetigo outbreak. But it will just present as these kind of flaky, kind of honey-colored crust that appear on the skin. It's that type of lesion. With men, it's more common, obviously, because of shaving. That can create small cuts in the face. And then, again, if bacteria from the nose get into those small cuts, it can obviously cause an outbreak. It's a very mild infection, very treatable. Honestly, most cases of impetigo, just keeping it clean and covered and then applying Neosporin will resolve the infection. In extreme cases where if it's not getting better after a few days, it would be recommended to see a physician and get prescribed an oral antibiotic, but it is typically seen as a relatively mild infection. On a more serious scale, there is also a disease called scalded skin syndrome. So scalded skin syndrome is relatively rare, but when it happens, it typically happens to children under the age of 5, most commonly newborns. So this is a disease that causes the outermost layer of the skin, which is the epidermal layer. It causes that layer of skin to peel back in large leaf-like sheets, kind of like what we'd expect for a burn victim. So the bacteria that causes scalded skin syndrome is a specific type of Staphylococcus aureus. It's not just your regular Staphylococcus aureus. This is Staphylococcus aureus that has the ability to produce a very dangerous toxin. And the name of that toxin, or toxins, are the exophylative toxins. So these are toxins that are released when they are released in the skin. They cause the majority of that epidermal layer to be peeled back. Fortunately, it's not all of the epidermal layer, which is good, because since it doesn't cause the entire epidermis to be peeled off, when someone has scalded skin syndrome, if they get treated early on with antibiotics, that's going to kill the bacteria, and then the skin, what's left of it, will be able to regenerate, and there'll be no permanent scarring. But unfortunately, if it's not caught early on, it can spread from the skin and then get into the blood, where it could potentially cause sepsis, which would cause a decrease in the blood pressure because of the bacteria in the blood, which then ultimately could cause the baby to no longer get oxygenated blood to organs and tissues, which can ultimately cause coma and death. So if it's not treated early on, it definitely can be dangerous because of the risk of it getting into the blood. But this particular bacteria, unfortunately, some people just do carry in their nose and in their throat, so in that nasopharynx region. So if someone is a natural carrier of this bacteria and they're handling, for example, a newborn baby that has a small cut, the bacteria could potentially get into the cut, where it could cause a case of scalded skin syndrome. And most of the time it starts off as a small lesion and it's caught right away and treated aggressively with antibiotics right away before it has a chance to spread. The one that we're looking at here in the picture, this is a pretty extensive case that has spread to this point. So this is a very severe case. This is probably a case where it has gotten in the blood and has resulted in sepsis. So this is a case where it would need to be treated aggressively with intravenous antibiotics. But as long as it's treated right away, most individuals will make a full recovery and then that skin will regenerate. But it does need to be treated very fast before it has time to spread from the skin to the blood, because once it spreads to the blood, again, it becomes quite dangerous at that point with sepsis.